Functions in Controlling Series 1, the Performance Appraisal. You are not only going to do assessments of patients, but as a nurse manager, you will be assessing and evaluating your staff through performance appraisals. As nurses in leadership and management positions, one of your responsibilities will be to complete performance appraisals on members of the staff that you manage. Performance appraisal is one of the biggest challenges in management. It is one of the most critical areas of employee relationship building. Nurse managers have to give performance appraisals that help motivate their staff to achieve goals and contribute to the hospital organization. Performance appraisals are an important part of the retention process. They may be called other things such as performance reviews or evaluation or your annual review. It is also something that is required by Joint Commission for healthcare facilities to have such a process to evaluate their employees. This is a great time to get the employees' view of their personal performance, their perceived need for improvement, as well as your improvement as the employer, plans for their future, their perception of management. This is a good time to ask them what things in their opinion worked good or works good on the unit and what things in their opinion would need to be changed to make better. Also, the annual performance review is usually done annually. New hires, they do it at 30-day mark upon hire and then again at 90 days. Your performance appraisal addresses your level of job performance and expectations. It also can be informal and formal. If used correctly, encourage staff, increase retention, increase productivity. If it's used incorrectly, it can discourage or demotivate the staff because it is viewed as a punitive process. There are several types of performance appraisal tools. As part of your discussion board for this module, you are going to be asked to retrieve your performance evaluation tool and evaluate it to be able to determine what type of tool it is, and also to see if you can identify the hospital's mission in that tool. The competence assessment is basically assessing skill and knowledge. It evaluates whether the individual has the knowledge, education, skills, or experience to perform the task. We see this on NCLEX. We see this with annual competency skills fair checkoffs. We see this also in new employee orientation skills checkoff. The performance appraisal examines how well the individual actually completes the task, and this is usually what our annual performance evaluations are. You have trait rating scales. This rates a person against a set standard such as a job description, desired behaviors, and personal traits. A behaviorally anchored rating scale requires separate rating form for each job classification and is tied to physically observable skills rather than conceptual skills. Self-appraisals. Usually with self-appraisals, it's based off of a portfolio of work-related items. It provides examples of work, your continuing education, any professional certifications, awards, recognition, any participation on healthcare facility committees, any authorship of policies and procedures, just anything that you've done within the year for your employer. It also includes employee goals and action plan, and it's usually done in a combination with other evaluation tools. Peer review is an evaluation carried out by your peers rather than supervisors. It promotes growth through feedback. This is an appraisal tool that's widely used in academia and medicine. Healthcare organizations are slow to adopt this type of performance evaluation. And the last thing is the 360-degree evaluation. This includes a variety of people to make the circle. So all internal and external customers that you come in contact, that means getting evaluations from your peers, your patients, vendors, subordinates, anyone that you have come in contact with during your daily work, and the results are summarized, and it's mostly used for development. Sometimes if you are getting ready for leadership positions, this is a common evaluation that is done, a 360, where you get to hear from different people about your performance. There are general components of a nursing performance appraisal form that I want you to notice. The foundation of the tool is usually the mission of the organization. If you look at the mission statement of an organization, there's a built-in performance evaluation in the mission. So when you look at this mission statement, what kind of nurse is this organization looking for? The mission of Community Hospital is to provide the health of the people of Louisiana through superior care, innovative service, health education, and disease prevention provided in a personalized, caring, and safe environment, building a better patient experience for you. So they're looking for someone who can deliver superior care. They are probably looking for someone who has innovation or who is innovative in service, has good ideas, somebody who is very fluent on health education and disease prevention. They're looking for someone to give a personal touch that is very caring, someone who is safe, and also someone who is focused on patient satisfaction. If you look at the percentage weighting of each component of your evaluation, the performance appraisal for this facility that has this mission, their major components are three things: customer service, unit-based care, which goes to certifications. Say you work on the pediatric intensive care unit, then any pediatric PALS, NOWS, certifications, anything that's specific to the unit that you're working on. You wouldn't necessarily be an oncology nurse because it's not an oncology unit, so it's unit-based specific care. And then hospital requirements. 50% of the weighting goes to customer service. So this facility really values customer service, and it's infused in pretty much everything that they do and everything they promote. So it's very interesting. It may be enlightening to you for you to find your performance evaluation tool and your job description, compare the two, and see if you are on board or right on point to achieving the components of your performance appraisal. It's very important that your employees should know where the line in the sand is drawn when they begin to work in a particular unit. However, how can people know what your expectations are if they do not know what the mark is? So you want to encourage your employees. If you are in the leadership management role, you want to make sure when you hire someone on that they understand their position description and they understand how they will be evaluated. There should be no surprises when it comes up for evaluation. We should know from the beginning exactly what the expectations of us are. Performance rating definitions. Usually merit raises are connected to yearly performance appraisals. This depends on your level, whether you achieve outstanding, exceeds standards, meets standards, needs improvement, or unsatisfactory. So everything is done objectively and you are ranked. Everything is usually given a numerical component so that it can be easily calculated, and then they have a formula that groups you into each level. And this is just an example of how merit increases in pay can be tied to your evaluation. So if you are outstanding, you would probably get a 5% increase, and your evaluation range would be 4.6 to 5. A 4% increase would be for exceed standards, and a 3% increase would be for meeting standards. So this is just an example for you if you are not familiar with how they come up with how much percentage merit that you get if you do get raises after evaluation. It's usually due quantitatively from your performance appraisal. So in reflection, I want you to take time now to locate your performance appraisal tool and self-reflect on the following questions. Some of these questions you'll be answering in your discussion. Do I know the standards of my evaluation? Get a copy of your position description and compare it to your appraisal tool. What type of tool is your performance appraisal? Do I know the mission of my employment agency? And do I know what my employment agency values? You should as an agent of the employer. Another important thing for professional nursing is to compile a portfolio. From day one, whenever the performance appraisal starts for your next annual performance, you want to start a portfolio binder that you keep all your certifications that you achieve, all your CE, any letters that you have received from your institution that has notified you that you are being placed on a committee or you've been asked to participate on a committee, any work that you have produced as part of a team or individually, all those things you need to keep track of and keep in your portfolio. You will bring this portfolio with you to the evaluation and use it as evidence to support if something is missing or if something is being left out of the evaluation. You bring that with you to the evaluation conference.